Today I'm going to talk about some of the advancements in the treatment of post-traumatic stress disorder. Post-traumatic stress disorder, or PTSD, is a condition of persistent mental and emotional stress caused by some severe injury or psychological shock. It can lead to many other anxiety disorders and other complications. In this presentation, we will review many of the recent developments in the field of PTSD treatment. We will look at different methods of treatment, including some that are experimental, and analyze promising methods and results. MDMA is a psychoactive drug with stimulant and hallucinogenic effects. In this study, half of a sample of 20 participants with PTSD were asked to use MDMA to treat it. The results were that the subjects experienced some persistent relief from PTSD symptoms, showing promise for this type of treatment. In this study, Rotate was used. Rotate is a therapeutic PTSD treatment method that focuses on supportive and expressive cycles and on teaching participants self-reliance when it comes to emotions. After studying 86 participants with PTSD symptoms, half undergoing Rotate, half not, they found that patients who participated in Rotate were 4 times more likely to be improving in their symptoms than patients doing normal treatment as usual programs. We also reviewed 2 studies where meditation was used to treat PTSD. The symptoms and meditations of 275 current and former members of the U.S. military with PTSD were tracked. Both studies found that meditation was linked to decreased PTSD symptom severity. Also, military members practicing meditation were less likely to use or abuse the prescribed PTSD medication. This shows some promise for future research into using meditation to treat PTSD. Virtual reality treatment has been studied as well. In Cambodia, 9 participants aged 18 to 65 were enlisted and asked to use virtual reality-based PTSD treatment. This led to improvement in symptoms and overall outlook, implying some promise to virtual reality-based PTSD treatment. One avenue to understanding PTSD is by studying why people choose to seek treatment. Of all the possible professions, firefighters in particular are likely to have a high risk of developing PTSD. In this study, 37,000 Korean firefighters were surveyed about their emotions and their feelings about PTSD treatment. 5.4% of surveyed firefighters had symptoms of PTSD, but of those, more than a third were concerned with the social stigma of receiving said treatment. We've talked about many approaches to PTSD treatment. From the MDMA study, we learned that designer drugs may be developed to target PTSD. Also, meditation and virtual reality can be used to assist in the emotional self-regulation needed to cope with PTSD symptoms. Additionally, Rotate has shown that traditional therapy methods can still be effective. Finally, we've shown that social stigma and lack of access to treatment can still be major issues when it comes to obtaining said treatment. In conclusion, PTSD treatment exists in many forms today. With enough resources, it is likely that PTSD can be successfully treated in time. Issues of social stigma, however, still exist. It is important that future work be done in treatment and in encouraging people to seek that treatment. Thank you.